you know, if you're in a class with a student that has meningitis, you should also receive an email, just to let you know. Okay? So, we talked about, you know, fungal meningitis just because last year or 2 years ago it was really in the news. We looked at meningitis, all right? We transitioned to looking at headaches. Oh, headaches. Vascular headaches, tension, hypertension, intracranial pressure, yeah. And intracranial pressure can be due to masses or bleeding. So please just review headaches. And then we looked at this. I still am willing to bet that if I said to you, draw out for me the flow of fluids in your brain, most of you could not reproduce this or understand what's going on. I could be totally wrong. But my experience is it takes multiple exposures to this to really grab hold of what's happening. This side is just the blood flow to the brain. Okay? This is very similar to what goes on in every tissue in your body. Blood comes versus capillaries, arterial capillaries, goes into the interstitial spaces, not the blood, the fluids, goes into the interstitial spaces, comes out of the interstitial spaces at the venous end of a capillary. So this, in a perfect world, would be tied together as a capillary net. Does that make sense? Are we okay with that? That's kind of basic to all tissues. What's really weird and bizarre about your brain is this. This is the CSF production. We have the choroid epithelium here. We've got the blood-CSF barrier. Please remember to review that. And we're going to produce cerebral spinal fluid, which is going to pass through the ependymal cells, get to the interstitial spaces once again. Those ependymal cells are located on the surface of the choroid epithelium in the ventricles. Okay? Once you're in so this can be taking place in the ventricular system or as a result of any spaces that have CSF in them. The CSF, some of that fluid is going to pass into the interstitial spaces, get to cells. This is your kind of turbocharging the brain. You're taking extra nutrient, you're taking extra oxygen, you're taking extra chemical precursors so that all of your brain cells, whether they are neurons or glial cells, have what they need. This fluid, there's an exchange between the interstitial fluids and the CSF. CSF then returns via the arachnoid granulations back into the venous blood flow. So it's pretty nice. Are we okay with this? Do I need to do anything else with that? All right. CSF versus plasma. Now, what you have to, pretty much the important thing here is you have a lot of sodium, you have a lot of chloride, you have a lot of protons. Bang. If you know those, anything else has got to be less. So, from here, we took a look at some blood flow issues. With the circle of Willis, I would expect you to know the vertebral arteries here come together to form the basilar, and then the components of the circle of Willis. So please review those. When we talk about meninges, when we talk about CSF, we can't ignore the venous sinus system. The venous sinus system is, oh, I'm sorry, yes?
Oh, sorry, did you say that's all you want us to know from that?
right now, that's what I would expect you to know. All right? Don't worry. I would say by next exam, you should be able to label this. No, for right now, with the circle of Willis, we have the vertebral arteries form the basilar. And then, what are the components up here that form the circle? In the future, we're going to add in, you know, all of these other arteries and everything. But for right now, all right? I'm trying to be reasonable. I'm only asking you to know 8,000 things for the first exam. We'll double that for the next one. However, this you should know, right? You should know, as I said, these major structures. We have the superior and inferior sagittal sinuses, straight. Cavernous sinus, the petrosal sinuses. Superior and inferior sagittal sinuses. This in here, the cerebral vein or the great vein. Okay? The straight sinus, you got two of them, left and right. The confluence, this is where a lot of things come together. Great question. What comes together at the confluence? A lot of stuff. That's a 1-point answer to a 5-point question. Okay? I mean, you've got, oh, this. Ah! All right? We've got the sigmoid sinus here. So, that's what you should know on something like that. I almost always ask good questions on this system. This is really critical. The majority of blood in your brain is in that system at any given point in time. We talked about 3 types of hematomas. I would expect you to know and read about those 3 types of hematomas. So. Oh, my arrows disappeared. We looked at the spinal cord. Okay? This is a nice cross section. Once again, in here, you see the meningeal system in the spinal cord versus around the brain. There are some subtle differences. Okay? This epidural space up here becomes critically important. Things like that. I think my computer no longer wants to play this game. You know, as far as this goes, I would like you to know and understand this right now. Okay? So we have the anterior spinal artery, we have the posterior spinal arteries, and we have these regions. As I said before, you should be able to overlap this with this and understand. Oh, that's not what I want you to understand. Understand that this is supplying mostly the posterior column. This is supplying mostly everything else. That's important to know and understand. Oh yeah, this one. Should you be able to draw and label those somatosensory and motor? Yeah. If you can draw and label those fiber tracts, those pathways, you'll be able to answer questions about them. On occasion, on an exam, I will have you do something that isn't there for points, but is there, you know, I may say, here, draw this out, because you're going to need it for something else, okay? And on occasion, by the way, I also give you sheets with illustrations that you might need for answering questions. Epidurals. You know, epidurals are a fact of life now with deliveries. This is really important information for you. So, different types of herniations and what the outcomes are. So I would I would expect if I ask you about a far lateral herniation, you could explain that to me. Or pick out the right answer from a list of possibilities. We looked at some disorders with nervous system, neuropathies, muscles, myopathies, and then neuromuscular junction. And then, do what I'm asking it to do. As I said, the rest of the this, by the way, this is a really good overview of your nervous system, just for your own information. But the rest of the autonomic nervous system will not be on the exam, okay? And then we did a little bit of spinal cord stuff that we wrapped up today. Is that enough? Cool. I don't know what else to tell you. I will be kind and fair and thorough. Questions?
I have a question. Figure 8.3 was a couple slides before.
Sure.
I'll tell you, where it has the C524.
That one?
Vertebrae. Yeah, that one.
Okay.
What did you say about that again? I kind of missed
So,
it.
we talked about the three types of herniated discs. We talked about far lateral versus posterior lateral versus central. And what are the differences? And the differences are far lateral is always what? Unilateral outcomes at one level. The posterior lateral, unilateral outcomes, multiple levels. So in other words, when you have this posterior lateral, you can affect this nerve tract, that nerve tract. Central, bilateral, multiple levels. Does that make sense? Cool. What else? Nothing?
How many questions?
As many as are necessary.
No, for the whole thing.
I don't know. I haven't written it. I don't know how many questions there are. If I ask you questions that are worth 4 and 5 points, there'll be fewer questions. If I ask you questions that are 2 points, there'll be more questions. There will be enough questions there to give you the point total that you need, plus probably an extra 2 or 3 points. I build in extra credit for you, not as an extra credit question, but as giving you a couple extra questions. So whatever question you want on there to be extra credit is yours. Yes, somebody else?
Blood flow to the brain.
What?
It's strictly just the internal carotid arteries and the vertebral arteries.
What's that?
For blood flow to the brain,
Blood flow to the brain.
it's the
Vertebral arteries, okay, and the internal carotid. The external carotid provides blood flow to where? External carotid. Oh, what a good question. Much of the musculature and bony structures and stuff. The internal carotids, however, the brain. Which is why, okay, we talked about the fact that you could build up plaque in arteries and end up with a stroke. You can have a stroke that's not in your brain. It's actually in your carotids. So, yeah. So if I block the blood, a stroke technically is blocking oxygenation to tissue. So, does that answer your question? Cool. What else? Nothing? Okay. If in the next couple of days you have questions, throw me an email. I'm going to be in Ontario on the weekend, but I will have internet access. So, I will attempt to answer your questions in a very timely manner. But remember, I'm going to be speaking a foreign language, so. All right, cool. I'll see you all